This will be a presentation on my philosophy of nursing leadership. My name is Tiffany Martin, and I would like to first say that my philosophy of life, my philosophy of nursing, and my leadership philosophy all have the same foundation, and that foundation is caring. I believe to be a leader, you have to first care, and as a leader, you will want your followers to know that you care. Otherwise, they may be following you just because they have to. I believe you want people to follow you because they see a behavior in you or a trait in you that they want to work towards or that they admire. My theory of leadership is grounded in Jean Watson's theory of human caring, and her theory has, excuse me, three major elements. Those elements are the 10 Caritas processes, transpersonal caring, and the caring moment. In this presentation, I will discuss the definition of Jean Watson's theory of human caring, as well as two research studies that use her theory as their theoretical framework. And then I will also discuss how Jean Watson's theory is used in nursing and then apply her theory to my personal practice as a nurse. So we'll backtrack and go back to the definition of human caring, or Jean Watson's human caring. Her website describes caring science as encompassing a humanitarian, human science orientation to human caring processes, phenomena, and experiences. She further goes on to saying that caring science can provide the foundation for philosophy and ethical nursing issues or nursing leadership and nursing at the disciplinary level. The elements again of Jean Watson's theory of human caring include the 10 Caritas processes, transpersonal caring, and the caring moment. I would like to briefly speak a little bit about the caring moment, as the caring moment means that moment when you interact with a person. That caring moment happens right away, whether it's through eye contact or nonverbal behaviors or through touch. That caring moment lets you know that the person you are caring for, it lets them know that you care, and that could be your colleague, your patient, it could be your employees. We want to engage, or in my philosophy, I want that caring moment to be the foundation of my leadership. I want those that follow me to know that every time you interact with me, you're going to get a caring moment, especially in regards to the 10 Caritas processes, which one specifically speaks on authenticity as a leader. And to have that authenticity, you need to first take time to ground yourself and become aware of behaviors that may not be beneficial to others. You want to get that stuff out of the way before you have your interactions with your employees. That way you will be able to provide that caring moment. And you want to be authentic and let people know that you care and that you listen and that your advice or your disciplinary actions or whatever it is that you are presenting is coming from a loving and caring place. The next thing I would like to discuss is the research studies that use Jean Watson's caring theory. The first one was a study conducted in 2011, and it actually focused on spirituality-based interventions on adults with cardiovascular disease, and these were adults that had issues with quality of life, depression, and anxiety. Jean Watson's theory looked at different ways to measure those behaviors in the communities dwelling adults. Basically, the research study used a spirituality scale, and that spirituality scale contained three domains of measurement, those measurements being self-discovery, relationships, and eco-awareness. Those domains correlated with the concepts of Jean Watson's theory, those concepts being, caring for yourself, your relationships, and others through mindfulness meditation and insight meditation and loving kindness. So this study took Jean Watson's theory, to provide their theoretical framework. It took her concepts of caring for the self and relationships and the environment to correlate with the domains of the spirituality scale that measures self-discovery, relationships, and ego-awareness. The second study that I would like to discuss was a study done recently. It was actually just published in the Journal of Holistic Nursing in 2014, the December issue, so I just received it. But anyhow, this study was focused on nurses. It provided an intervention for nurses to be able to better describe what caring meant to them and how they implement caring, how caring affects their relationships with patients. The nurses were taught a self-care modality, Jinsitsu therapy. It's a type of almost martial arts, but it's used as a self-care therapy. In this study, the measurement or the scale used was called a CEF, or Caring Efficiency Scale. And again, Gene Watson's concepts served as a theoretical framework, and for this study, the scale was measuring the stress and caring efficiency levels, and they correlated with Gene Watson's curative factors. Her curative factors actually served served as the validity instrument for this study. And basically, they used this scale to create or relate the nurse's understanding of their caring behaviors to Watson's caring theory. So in both of these studies, the authors and the researchers took her took her curative factors, or the foundation of her caring philosophy, and were able to relate her theories to the scales they used to measure outcomes in their studies. The next thing I will discuss will be how hospitals or nursing applies Gene Watson's theory. And I'd like to start off with saying that her website, or her company, or her institute rather, the Watson Caring Science Institute, they provide a program, an accreditation program for hospitals to apply for the program, and applying for this program basically states that the institution provides that model of caring for their patients, their coworkers, family members, and the hospitals benefit from this program through receiving recognition on her website, as well as lifetime memberships to her caring conferences. She holds 2 conferences a year, and any publications and things like that she puts out. Another way nurses use her theory or her work is through, she has a Caritas coach training program. It's a 6-month program, provides CEUs, and it basically helps nurses to provide or to implement the Caritas processes in their work to bring transformation in their institutions. 2 Caritas coach program graduates that I would like to briefly just touch on, because I feel like their projects were interesting, were one student or one graduate of the program used her theory to create a stress reduction technique, or maybe like an environment rather, for nurses who worked in the ER. This was done in Denver. They set up a program for nurses to be able to come in and have some stress relief and relax after their shifts. Another Caritas Coach program graduate used the theory in actually a nursing philosophy course, a graduate level nursing philosophy course. This was in Canada. And the folks basically wanted students to experience nursing theory, so they chose Gene Watson's theory and trained the instructors on creating that caring environment and those caring moments, so that the students would better understand not only philosophy and the theories, but also how the theories can apply to real life. Finally, I will discuss how I implement Gene Watson's theory in my nursing practice. And I would like to first start off by saying that the theory of human caring, for me, it's not just utilized in my nursing care, it's also a very big part of my personal life. So as a nurse, I believe in every interaction with the patient creating that caring moment. I also use her theory in my graduate work. Whenever the opportunity presents for me to complete a project or do some research, I like to further investigate and further research into Gene Watson's theory, and I've used it for a great deal of my graduate work, and I enjoy every opportunity I get to use her work. Finally, I use her theory in my practice as I am a level 1 Healing Touch student. And Healing Touch is a energy modality. It's accredited by the American Nurses Credentialing Center. And the Healing Touch program, based their program, they use Gene Watson's theory of human caring to provide the philosophy and the ethical foundation of their program. So whenever I practice Healing Touch, I am also implementing Gene Watson's theory in my care. I will attach, as this is the end of the presentation, I will attach my resources, and I encourage you all, if you have the time, to investigate the links in the articles to learn more about Gene Watson's theory of human caring. Thank you for your time. Bye-bye.